Hello, and welcome to the Commissioner's Corner. I'm Fort Bend County Commissioner Grady Prestage. We're joined today by Dr. Letosha Gale-Lowe, Director of Fort Bend County Health and Human Services Department. Welcome to the Commissioner's Corner.
Thank you. Thank you for having me.
Yeah, well, you've got a very busy job. Very busy job. Fort Bend County has grown from a sleepy rural county to an urban county, the 7th or 8th largest county of the 254 counties in the state. So it's a pretty big role. Big role. Tell us a little bit about your background and what brought you to Fort Bend County Health and Human Services.
Certainly. So I am a Fort Bend County native. Grew up here and went to a local high school. Was called at the time the High School for Health Professions. It is now DeBakey. Went on to get a degree in chemistry at Fisk University, and then went on to get my MD at University of Texas Health Science Center in San Antonio, followed by residency in Dallas, and then came to work here in Rosenberg. So my first job as a physician was actually here in the county I was raised in, with a wonderful gentleman, Dr. Sylvester Vons, and that led me through almost 2 decades of private practice in family medicine. And from there, went on to public health at the city of Houston, where I was responsible for some clinical oversights, and then finally was able to come aboard here at Fort Bend County.
Tell us about your department. Health and Human Services is a pretty big department, a lot of different functional areas. Tell us about
Absolutely.
this department.
So this department has 9 divisions and 3 support divisions. We range from animal services, clinical health services, all the way to EMS. And I think that's something that people don't realize here in Fort Bend County, that EMS services are under Health and Human Services. And that is basically about 300, a little over 300 staff members.
Okay, in Health and Human Services or just
total,
including EMS?
Including EMS.
Okay, that's a real department. You know, I go back to when I came here. I've been here a long time. We didn't have a full-time health director. We had a part-time physician who was actually an OB-GYN, who was the public health authority. And there was a lot of misconceptions about what public health really is. So for the benefit of our viewers, tell us your definition of public health and how's that practiced here in Fort Bend?
Sure. So basically, public health is the health of communities or populations. For me, as a family medicine trained doc, or many docs that we know and are familiar with, docs are trained to take care of one individual at a time. When I go into the doctor's there to see me to address my need, and they go on to the next. But when it comes to public health, the idea is to address the health of a community. And so we do that in various ways. We do it via disease prevention. We do it via policy. We do it via education. We do it through preparedness. So those are some of the ways that we address population health. And that is the basics of public health.
Yeah, that's a tough explanation to give all the time, because people say, well, what exactly do you do? It seems like you're just being ready for something bad to happen or some catastrophic situation. So how much of what you do is actually just preparedness, just to be ready for the next disease outbreak or the next crisis of whatever kind?
Sure. I mean, our bread and butter, much of what we do is about being prepared. It's important. You know, it is not necessarily that it's seen by everyone that we're doing the work behind the scenes, but our epidemiology staff, our preparedness staff, we're always training, always getting ready, always keeping ourselves ready, not necessarily because we are just anxious because something bad is going to happen, but a prepared team is an effective, nimble team. And so that is the importance of always training and always being prepared. So I would say that while there is not always, or should be, the thought that there is angst around public health when we come around, something bad must be happening, that's not it at all. We are here. We are just eyes over a community to ensure we're there to help. If there are needs that the community speaks to us, we are a resource. We have tremendous relationships with community partners. We have great relationships internally through our county departments. And we use those partnerships to offer to residents of the community in whatever way we can to serve them.
Talk to me about the county's role in indigent care as mandated by the state.
So we are required to provide indigent health services to those who meet the definition of poverty. And of course, we know that is governed not by us, that is a number governed by the state. And we provide those services very, very well here in Fort Bend County. Our indigent health services have received numerous state awards for their efficiency, for their effectiveness in providing and linking members of the community who qualify for those services. Essentially, people bring qualifying material to determine whether or not they meet this economic qualification. The team verifies that information, and there are physicians throughout the county who have signed up to say, yes, I will be a part of this practice. I was one of those physicians when I was in practice here in Rosenberg. And it's a wonderful way to provide services and to people who may not normally get the care that's really needed and who are probably some of the most vulnerable in our communities. So it's a tremendous asset to have. It is a little difficult when you have a small population, so you're only meeting the need of just a few people, but the people who we're able to care for, we're able to provide that service very well.
I know that Fort Bend County does the minimum of what's required. I mean, is that a safe statement? I mean, if we've established our level of service at the absolute minimum,
requirement.
Requirement. And since this is my little show, I can give my little commentary. I've always wanted to be more. The times right now are a little strange politically from the national level on down. A lot of cutbacks on a lot of things. If there's some trickle down effect where we find ourselves having more people eligible than we expected, could we scale up with the current arrangement that we have?
I think we absolutely have the ability to scale up. I think what is important also is that we continue to invest in the infrastructure because to add population onto infrastructure that may not quite be as substantial could have a deleterious impact on the client, right? So I think it's important that we really invest in the infrastructure. And what does that look like? That looks like we have the appropriate staff. It looks like we have the technologic infrastructure that we can do some of the work that needs to be done, and that we really encourage relationships with physicians in the community. I think that is the most untapped resource. We I think really beginning to hone in and build those relationships because they are the ones who people have trust in. They're the ones rendering the care. We in Health and Human Services and our clinical health services do not provide preventative health services. We provide core infectious disease sort of services. So who do we need? We have to have the docs in the community. And so I think in order to really build a robust indigent care system, we really have to begin to bring in and let the docs know that it really is a win-win. It is not that sometimes there's this thing that, well, these are the sickest people and they're going to require so many resources. But if we can get in and we can start some of the preventative work, it doesn't have to be that way, right?
Yeah.
So those are my thoughts. I think that certainly we can broaden and expand increase the poverty rate that we choose. Instead of 100%, can we do 250% of the poverty rate? Can we do 400% of the poverty rate? And that will cover far more people in the community.
Yeah. One thing that about that poverty rate is this is based on income, household income, and family size, I guess. But a lot of people can't qualify because they're assets. And we've set a standard there where if you have X amount of assets, and I can't quote what it is, but it eliminates a lot of people from getting our service. What are your thoughts about changing the asset limits? If you have a car, then you out.
Right.
If you have a house, regardless of how much income you have or what's in that house, you don't qualify for this service.
Yeah, I think that is, I think it is extremely inequitable. Right. And so to release that requirement, I think would be so helpful to have people not bound to that particular asset requirement. Because again, when people think about public health, and this is a great myth and misconception, when you think about public health and you think about the services provided by public health, there's this automatic thought toward poor people. And we have a lot of people who have not as many resources, and it doesn't look like poverty.
Right.
If that makes any sense. So it may look like you're a 28-year-old who is staying at home with mom and dad, and they can't afford to have an apartment, right? Because they just finished their degree and they're trying to get into the workforce and having difficulty in the workforce because people want work experience to get into the workforce. But I have a master's degree, I'm working on my PhD, and I can't get, and the earning potential of that individual, well, not the earning potential, but the earnings that individual is considered poverty, right? So it's not always somebody who is homeless or destitute, right? And so I think we just need to get our minds around some of the things that we see in our own families.
And they can be people who are doing well one day, and life throws you a curveball, and then you find yourself in that situation.
Absolutely.
It's that safety net. I've long been an advocate for that, but I'll tell you that it's been a long time coming. I mean, just trying to make the case for public health had been tough for a number of years, and it's a while before we actually got a full-time health director. We've had great success after we got it, after we figured it out. I want to fast forward from those times to the most recent trauma that we all went through, which was the pandemic. Okay, so you kind of came in on the tail end of the pandemic. There was one of your predecessors who was in the heart, who came. I think the pandemic came with her.
Yeah.
Okay, and then there was one who retired just in time. What lessons did we learn from the pandemic that might be noteworthy to our viewers?
I think one big lesson that we learned is that it's so important that we have standard messaging.
Gotcha.
Right.
Understood.
There were often, at no fault of any local persons at all, but there were so many voices giving instruction because we had not been in these times before.
100 years.
Right. Right, since the flu pandemic. And so I think that was the big thing, is that how can we communicate in a standard way across jurisdictions, federally down to locally, in a way that makes sense, and it makes sense to the public, because they're hearing one thing and they're on board, and we're doing, then we're shifting and we're changing, and so that was a little difficult, right? It was difficult, and what it has created is apathy when it comes to public health wanting to talk about vaccines, or we want to talk about prevention of respiratory viral illnesses. It produces some apathy and some, yeah, we've heard the story before, and we don't really want to hear it anymore.
Yeah, I think people want to go away and be forgotten for the most part.
Yeah,
But I guess reality is such that it could happen again.
absolutely.
It could happen again. The latest concern has been the measles.
Sure.
And so and while it happened in Texas, primarily in West Texas, and they all say it's mostly an unvaccinated population, but we're all not, and pardon the pun, immune to that kind of outbreak here in Fort Bend County. What are your thoughts on the measles epidemic and how we position to deal with it if it knocks on our door?
Sure. So, as we've known and we put out in the community, we've had a measles, right? We've had it, and how are we positioned? We are positioned well to address. We have a great staff of epidemiologists. We have a great comms team who's able to help us communicate the messaging. We have a wonderful clinical health services team who can stand at the ready to provide vaccines should they be needed. We have wonderful relationship with our local jurisdictions in Houston and Harris County. So if there is testing that needs to be done and at our local LRN lab, Houston is amazing at being a great team player, and so is Harris County. That was a great a lesson as well that came out of COVID with the director that was here prior to me. The camaraderie that was developed among directors and local health authorities with one another to build bridges and to access resources interjurisdictionally really came to bear. And we still have those types of relationships, and that's really important. So if it should come and should come at some great force here to Fort Bend County, then we're able to lean on our neighbors that are next door to us to acquire resources.
As we wrap up, what do you see as the future of your department, Health and Human Services in Fort Bend County?
Oh, thank you for asking that question. So really important for me, and I see is us growing our infrastructure. And again, for me, that looks like being nimble and agile. It is important that we have technology to help us do that. We cannot use paper anymore to do all the things that we do and expect to be efficient.
Correct.
So we have to invest in that particular type of infrastructure. And we want to use that so that we can communicate. I think it's so important when I talk to people in the community and I say, what is it that you're looking for? What is it that you want to hear? And sometimes it is just we just want to know, why did you make that decision? Why are you telling us to do that? Rather than just telling us to do it.
Right.
Why do we have to do it? Why do we have to get our children vaccinated with this when I was growing up, we only got vaccinated with this? Right. And I think in order to give people the why and to bring about the education, using our resources to engage community, so we will engage community more. And we'll engage them in a little bit more intimate setting, so we can hear, right? So we can really hear what the needs and concerns are. We have internal town halls because we also need to make sure that as we grow and move forward, that the team internally is a unified team and that we're walking together lockstep with one another and we're saying the same thing. So that when we go out as representation of Fort Bend County HHS, we are going out saying the same thing, whether you are an environmental health sanitation worker or you are an EMS paramedic. So those things are important. Having one voice, ensuring that we are meeting the needs of community and that we're doing in a technologically savvy way, that we can present data and information in an easy way that will allow people to make informed decisions.
Right. Well, I'm certainly fired up now. I think that we're well positioned to handle whatever the growth and development calls for for the future of Fort Bend County. I'm happy and honored that you're here with us for many years, I hope, and we'll see where that goes.
Yeah.
Thank you, Dr. Letosha Gale-Lowe. That's it for this edition of the Commission's Corner. We'll see you next time.